So we'll get to quickly look at another type of it's like a classification of drugs that are used in the treatment of heart failure. And for these drugs, they are a class, right? So when they are a class, we call them the same name. So that these ones are the non-positive inotropic agents. So these non-positive inotropic agents, we actually want to look at what they are and also the examples of drugs under this class. So let me quickly get my pen. So for what we have here, so what's the concept of non-positive inotropic agents? The positive ones, they are the ones that will increase the heartbeat. So drugs like digoxin, the butamine, you get. For the non-positive ones, these ones, they will improve heart failure outcomes without increasing contractility, you get. So the benefit comes from reducing the preload, reducing the afterload, controlling the neurohormonal activation, maladaptation, remodeling. Do you understand? They don't really focus on increasing the heartbeat, for them to be able to handle this issue. So major class, we have the angiotensin converting enzyme inhibitors. So drugs like enalapril, I have enalapril here, lisinopril, so they basically block the conversion of angiotensin 1 to angiotensin 2. Do you understand? So they now reduce how the heart is actually beating by stopping that particular product. So clinical use, they are mainly used for treating of systolic heart failure, or the first line in that. Then we have the angiotensin 2 receptor blockers, that's ARBs. So drugs like Losartan. I didn't bring Losartan here, that's crazy. But you have drugs like Losartan, then we have the valsartan. Then we have the angiotensin receptor, nitrile lysine inhibitors. So drugs like the Sacubitril and the valsartan. Those ones, they basically cause the blood vessel to increase in size, thereby causing that the blood flow is more easier, Then we have the beta blockers, so drugs like Carvedilol, Metoprolol, Bisoprolol. They block the sympathetic stimulation of beta receptors. They decrease the heartbeat. They decrease all those irregular or abnormal heartbeats. They also decrease remodeling. Also, primarily they improve survival, right? So we have diuretics. These ones are basically there to make sure that in heart failure there's accumulation of sodium and water back in the system. So these ones will help that the sodium and water is put out. So drugs like furosemide, thiazide is like the hydrochlorothiazide. Then we have the potassium sparing ones like spironolactone. Then we have the aldosterone antagonists like the spironolactone and also the Eplerenone. Then we have vasodilators. These ones are basically to make the blood vessel size increase. So drugs like the hydralazine and the isosobide dinitride. So they usually even combine it, So hydralazine and also isosobide dinitride, Then we have the SGLT2 inhibitors like the Dapagliflozin, the Empagliflozin. They inhibit renal glucose reabsorption, leading to osmotic diuresis, leading to decreasing preload and also decreasing afterload. They also have metabolic benefits. So this is what we have for these drugs that we can see for this classification. This is what they actually do in the treatment of heart failure.